Hi, my name is Shirley Gutkowski and I'm a dental hygienist. I'm talking to you today from my home office. Did you ever think about your saliva? Really, most people never think about their saliva until they don't have any, and that's what I'm here to talk to you today about, dry mouth. There are a million remedies for dry mouth. None of them seem to work very well. If you have dry mouth because you're taking a medication or if you're having allergies, usually something over the counter is pretty good for that. You can find something that has some salivary enzymes to help you break up the biofilm that can grow on your teeth. But if you have Sjogren's syndrome or if you've had head or neck radiation therapy, you're in a world of trouble right now, and I know exactly what you're going through. And that's the kind of person that you need to work with your dentist and dental hygienist. So how do you find somebody who's going to work with you at that level? Because there are other things to consider than just those little salivary enzymes. What you need is to replace the other components in your saliva too. Without saliva, you are much more likely to have cavities, you're much more likely to have periodontal infections, and with cavities and periodontal infections come systemic problems that you are not in the mood for. Because if you have Sjogren's syndrome or if you've had head or neck radiation, you don't need any more problems. You need to find a dentist and dental hygiene team that's going to help you keep your teeth. One of the things that they need to do is make sure that they are replacing the calcium and the phosphate from your saliva that you don't have anymore. Those two components in particular help rebuild your enamel. That's right, that's what you need to rebuild your enamel, not more fluoride. You also need to find a team who's going to be really invested in speaking with your healthcare provider, your rheumatologist or your oncologist, so that they can work together with prescriptions that can help you with your dry mouth. So make some phone calls. Ask if they do have a specialization in dry mouth and what do they do in particular for people in your kind of condition. Don't be afraid to ask. Don't be afraid to ask specifically for the dental hygienist. She will call you back. So those are the surface kind of tips that you need to know in order to get your health maintained and reestablished. So give me